Blood collection, equipment, additives, and order of draw. What is blood collection? Blood collection is a puncture of a vein as a part of a medical procedure, typically to withdraw a blood sample or for an intravenous injection. It is also called venipuncture, the easiest way to collect blood from an adult patient. The equipment necessary to perform a venipuncture are gloves, needles, hub, evacuated tubes, micropore, gauze, alcohol wipes, tourniquet, sharps container, syringe, and the request form. The additives for the lavender top is EDTA, which stands for ethylene diamine tetraacetic acid. Next, the blue top is sodium citrate. For the green top, contains heparin. For the gray top, contains sodium fluoride and potassium oxalate. And lastly, the red top, which contains clot activator or gel. For the order of draw, first, we have the blood culture bottle, which is the yellow or yellow-black top. Second, coagulation tube or the light blue top. Third, the non-additive tube, which is the red top. Fourth, heparinized tubes or the green top. Fifth, EDTA tubes or the lavender top. Sixth, the oxalate or fluoride tubes, which is the gray top. For blood collection procedure, first, a phlebotomist must have a professional courteous and understanding manner in all contact with all patients. Second, identify the patient by two forms of identification. Ask the patient to state and spell his or her name and give you his or her birthday. Third, check the requisition form for requested tests and other patient information. Fourth, gather the tubes and supplies that you will need for the draw. Next, position the patient in a chair or sitting or lying on a bed. Next, disinfect hands. Next, select a suitable site for venipuncture by placing the tourniquet 3 to 4 inches above the selected puncture site on the patient. Next, put on latex gloves and palpate for a vein. Next, when a vein is selected, cleanse the area in a circular motion, beginning at the site and working outward. Allow the area to air dry. Next, ask the patient to make a fist. Grasp the patient's arm firmly using the thumb to draw the skin taut and anchor the vein. Next, insert the needle through the skin into the lumen of the vein. The needle should form a 15 to 30 degree angle with the arm surface. Avoid excess probing. When the last tube is filling, remove the tourniquet. Next, remove the needle from the patient's arm using a swift backward motion. Next, place gauze immediately on the puncture site. Apply and hold adequate pressure to avoid formation of a hematoma. After holding pressure for 1 to 2 minutes, tape a piece of a gauze or band-aid to the puncture site. And lastly, dispose of contaminated materials supplies in designated containers. This is a sample for blood collection procedure.